Hi there. My name is Michael Perryman, and Dr. Ninyala had asked me to, if I would be willing to leave a testimonial, and I had to say it is my honor and privilege to leave a message and get on here and tell you guys a little bit about my story, because for a while now I've been struggling with some health concerns. And to kind of give you a little background and to make a really long story short, many years ago, back in 2008, I started coming down with what I just thought was just normal allergies and those type of things. Turned out that those symptoms were a little bit more severe than I thought. It turned out that I had a fungus inside my nose that wasn't really going away. The ENT doctor that I had seen at the time had told me at that time that he wanted to refer me to another ENT specialist, as he felt I needed some surgery to remove the different polyps and also the fungus. So I went in, saw this other doctor. She ended up doing a surgery. That surgery went well. A week later, I went back for my post-op. Bad news is when I went back in for my post-op, all the fungus, all the polyps had grown back. My doctor at the time was just like, I can't believe how aggressive this has come back. It's like we never did anything. So she actually repeated the surgery. After, again, followed up about a week later, and everything was still growing back. So she put me on several courses of antifungal rinses, antibiotics, other different traditional medicines, and nothing really was helping. Eventually it got to a point to where my symptoms were dying down, and I was just kind of sick of spending my life at her office. And so I just thought I would deal with it. So I kind of put things off for about a year and a half or so. After about a year and a half, things had gotten so bad that I just couldn't stand it anymore. I couldn't breathe. My smell had pretty much vanished at that point. So we went back and saw my ENT doctor. She looked up there and things were just so bad that she ended up repeating the surgery. And again, to make this long story really, really short, she ended up repeating this surgery 4 to 5 times with no results, no resolution. She had me on 20 different antibiotics that I probably could count that were hopefully trying to clear up this fungus and the infection, because the fungus that was in there also created a staph infection also on top of the fungus. And so that's the reason why she was using antibiotics. Again, still doing the antifungal rinses, and got to a point where, again, she just was having no success. Life kind of got in the way. At this point, I had already had about now 8 surgeries from the previous time that I had spent with her and the time that I was currently spending with her. And so I kind of just went on my own a little bit, and life got in the way. I got busy doing other things. Again, kind of the same situation happened now about 6 years later. Things are again so bad. I go back and she has to repeat more surgeries. So now we're up to about 10 surgeries. This point, she was just like, man, we've been seeing you. We've been dealing with this for quite some time. We're not making any headway. I need to send you to the go-to guy, who was actually a really famous doctor, an ENT specialist. He's an adjunct at Mayo. He was the guy to go to if you were to look at his qualifications. It took me a long time to get in to see this guy. I eventually get in. He looks in there, and immediately his first thing he says is, "Look, we need to do another surgery." And I'm like, well, surprise. So he goes in there, ends up doing just under a 5-hour surgery. And what he ended up doing this time that was different was he ended up removing and cutting away all my sinuses, all those little nicks and crannies, because his thought was that if there's little spores that could be hiding in different little nooks and crannies, then maybe they're coming back and that's where this is continuing to grow from. So he ended up cutting away my whole sinuses, which was really a big risk because he told me even before the surgery that my face could cave in, I could have other complications for as far as smelling, as far as vision. There's a lot of things that could have gone on, but just because of the location of where it's at. So a week later, I go back for my post-op and everything looked great. And I was thinking, man, I was excited. I was going, man, okay, maybe for the first time, maybe we kind of got ahead of this. So he was just like, well, I want to make sure that we're staying on track. So let's have you come back in now another week. So now we're 2 weeks post-op. I go back in, and just like with the other previous ENT doctor, everything had grown back. He was just floored. He was deflated, and I was deflated, and we were trying to figure out what to do next. He couldn't really do more surgery on me other than just scrape things out because there's nothing else to cut in there. And so finally it got to a point to where all the different antibiotics that I had been on, all the different antifungals I was on, the infection which had turned into a staph infection and which was later confirmed as MRSA, eventually got to the point where I ended up having some stomach pain. So I went and saw my primary. My energy levels were really just so low, they're below zero, not even at a baseline at this point. Got to a point where I went and saw my primary. He sent me to a gastroenterologist to kind of check on this stomach pain. I was noticing I was having little red dots on my skin and other things like that. And there was just some other general things that I didn't really think were related to my nose or anything, but it turns out that they were. And so what had happened is that this fungus and all the infection and all the different antibiotics had led to cirrhosis of the liver. Now, I've never drank in my life. I don't smoke. I try to eat a healthy diet. And so now I have cirrhosis of the liver, stage 4. My platelet level counts were so low that that's where all those red dots were coming from when I would exercise, and I would have these little micro traumas just from the exercise. I didn't have the platelet count to be able to clot, and so I was getting these little red dots on my skin, so I was bleeding out. My white blood cell counts were really, really low. At this point, I was just kind of at a really all-time low for me, and so at this point is when I contacted Dr. Ninyala, and it turns out that Dr. Ninyala, because of the person she is and the way she cares about just wanting to help people get well, she was able to review my labs, and she was just like, at this time, let me just see what I'm seeing just from a lab standpoint. And so she was looking over my labs, and she was noticing that not only did I not have any hormones in my body, I was severely malnourished, that I had candida in my body, that there was a series of things. And so she said at this point, hey, why don't you work with your doctors and inform them of these things that I've found. So I was working with my doctor and my ENTs and these things that I've found, and she was also giving me suggestions as far as supplements that I could buy on my own. And those were helping a little bit, but it wasn't until it got to a point where things had gotten so bad that the smell had turned to where all I was ever smelling was just kind of rotten flesh 24/7. It was making me nauseous 24/7. My energy levels were so bad. My liver function had gone down at that point, and at this point, my primary had gotten me over to my gastroenterologist, who then, because of my liver function at this point had dropped so low that they were transferring me now over to the liver transplant center. And so now at this point, I'm really just kind of afraid for my life. I got 2 young kids, a wife, and I own my own business as well, and I was trying to grow that business. And it was at this point that Dr. Ninyala could see how much I was hurting, and she said, you know what, I think I have something that you need to try. And I said, okay. So we talked a little bit, and she looked over some more labs, and she was just like, so have you ever heard of ozone therapy? And I heard of ozone before, but I've never really heard of it as being used as a therapeutic modality. And she told me what it does and things it can help with. And so through her advice, we started with the ozone. And at first we were just doing it rectally. And so we compared the latest lab work from where I was at, and we were just going to see how well it was going to help with my liver. Well, we did it for 1 week, 2 weeks. Then we did it for a total of about 5 to 6 weeks. I then had more lab work done, and my liver function had improved. It actually had dropped anywhere from, there's 3 different scores that they kind of really look at there, but each one had dropped, if not 8 points, some dropped up to 12 points, which was a huge, improvement. What the other big thing that was really noticeable is that they measure people when it comes to liver transplant as a MELD score. And anytime you're anywhere around a 17 or 18 is when you need to start looking at having a transplant. When I first went to the liver transplant center, my MELD score was a 16. Through some of the advices that I took from Dr. Ninyala, some of the supplements, those type of things, that had brought it down to a 13. And that's where we were when we first started the baseline of doing this ozone therapy. We're at a 13 of a MELD score. 6 weeks later, my MELD score dropped from a 13 to a now 12, which just 1 point is huge. It's now going back into the normal ranges. It's not where it needs to be yet, but it's going in the right direction, of course. However, at this point, Dr. Ninyala was saying, what's causing the liver damage, and if we don't fix that, your liver is always going to continue to get worse. And so what's causing the damage was the fungus and the staph infection inside my nose. So she said, now let's start concentrating on using this ozone therapy for your nose. So we'll do it both rectally and also through the nasal passages. Well, as I've stated before, every session I've gone to, every appointment I went to with my ENT doctor, every time he would stick a camera in my nose, it looked like a war zone. It was just fungus everywhere and polyps and infection, and it literally something aliens would be made out of. And at this point, I had seen Dr. Ninyala several different times. We have done nasal ozone now for almost a week and a half. I then have an appointment with my doctor, ENT doctor. He sticks a camera up there, and there's no fungus at all. There was no infection. There was just remnants of the infection. So he just sucked that out. But more importantly, the great thing about that was there's all healthy tissue too. So all the tissue was pink, and it was starting to regrow, and it was starting to regenerate. And so my experience with Dr. Ninyala has been not only has it meant the world to me because of her taking the time out of her life, out of her practice, to treat me, to help get me to where I can be around for my family, but introducing me to something that's a little bit maybe outside the box, but at the same time, it's been so effective, and the only thing that has worked out of all these different things I've tried, from the other many doctors I've had, from an ENT to a primary to a hematologist to a gastroenterologist, and all these traditional medicines never did anything. In fact, if anything, they just caused me to have cirrhosis of the liver. And so I highly recommend, and if you're looking for something out there that's a little bit different, if you're struggling out there with infections and other things that you're just not sure, no one's really been able to help you, I highly recommend you contact Dr. Ninyala with Ascends Natural Medicine, and let her know I sent you. Let her know that I highly recommend you seeing her, because what she's done for me has been truly life-saving. And I appreciate the time to be able to speak to you today and you guys listening to my really long story. But again, thanks so much, and contact Dr. Ninyala.